Hello everyone, Dr. Beth here, and welcome to another episode of The More You Know. For the month of November, we're going to be covering osteoporosis as well as overall bone health. So what is osteoporosis? I'm sure most of you have heard of it. It's also known as brittle bone disease. So this is a condition where you begin to have less dense bone, making it more likely for you to sustain a fracture. Okay, so that's the big problem with this disease. Now, common fracture sites for osteoporosis include the hip, the pelvis, the spine, the wrist, and the humerus, which is the arm and or the bone in our upper arm. So what is osteoporosis caused by? Well, it's actually caused by our body breaking down bone quicker than we're able to make it, or sometimes a combination of both. So sometimes we're still making enough bone, but we're breaking it down too fast, or we're breaking it down at a good speed, but we're not making it fast enough. So it can be one or the other, or actually a combination of both, contributing to this disease process. The thing I think to remember is that our bones are always changing, and so we have specific cells in our body called osteoclasts, that's with a C, and these are responsible for breaking the bone down. We also have cells in our body called osteoblasts with a B, and these are the guys that are responsible for building our bone back up healthier and stronger. So we are constantly remodeling or rebuilding our bones. As a matter of fact, we have a whole new skeleton about every 10 years because our body is constantly working on our bones. So risk factors for osteoporosis are age. So if you're 65 and older, you're at an increased risk for developing osteoporosis. Another one is smoking. There's also excessive alcohol use, and that's been defined as 2 or more drinks a day, being underweight, or having a small frame. If you're heavier, you're carrying around more weight, which means you're putting more stress on your bones day in and day out, whereas somebody who's a little bit more petite, on the very thin side, you're gonna have less bone density and be more susceptible to osteoporosis. And then those that have a sedentary or an inactive lifestyle are more prone to developing the disease and the complications. We also know that certain medications, and in particular, proton pump inhibitors, which are often prescribed for acid reflux, are actually increase the risk of having osteoporosis. So some of the medications that fall into this group are Prilosec, Prevacid, Nexium, Protonix. And again, we don't recommend stopping these without your physician being aware and helping you, because these class of drugs in particular have some side effects when you go off of them too quickly, so they've got withdrawal symptoms. But definitely if you're on these medications and you're not sure if they're really working for you anymore, or if you're concerned about osteoporosis, have a good conversation about your doctor on the risks and benefits of being on that medication. So in addition to medications that are going to predispose you to having osteoporosis, there are medications that are ideally prescribed to help you combat the osteoporosis and improve your bone density. But further studies into these medications have actually shown that they're more likely to cause further damage and some really big risks, and the risks typically outweigh the benefits. What they've actually found is that an osteoporotic bone is not likely to fracture unless you have a fall or you try to lift with improper techniques. So the current recommendations are not necessarily to get on those osteoporosis medications, as they're not as beneficial and they have a lot more side effects than we thought. We know that your osteoporosis or your bone density, so your osteoporosis risk, is measured by the DEXA scan. And I believe that Erica has gone over that in some of her work, so I'm not going to cover that again here, but it is recommended that you get a DEXA scan after age 65 to figure out if you've got good bone health, if you're starting the progression and you have osteopenia, or you've already progressed to osteoporosis. So the main thing about bone health, just like anything else in life, is use it or lose it, okay? And so in the next couple of videos, we will cover more in depth the best exercises that you can do to improve your bone health. Thanks so much.